structured phaco training a burning need. As we all know, many young ophthalmologists face limited exposure to cataract surgery during their training, and our goal today is to address that gap. In this session, we will share practical approaches and structured methods to help every surgeon transition smoothly and safely from wet lab training to basic cataract surgery to phaco without compromising on surgical quality or patient safety. Our first talk today is by Dr. Shobha Sara Mathew, who will be speaking on Practice Makes Perfect, Role of a Wet Lab. Dr. Shobha is a highly skilled cataract surgeon with cornea fellowship from Singapore National Eye Center. Her insights today will highlight how the wet lab serves as the perfect bridge between theory and real-world surgery. Dr. Shobha, over to you.
Thank you, Dr. Nilofer, for this opportunity to talk. So, the role of wet lab, it is a very important topic which we cannot replace with anything else. So, when it comes to ophthalmology, we are dealing with 10-0 nylons and micro instruments, and the size of the instruments all changes. So, what is the role of wet lab in ophthalmology? Before we are going to do surgery in a patient, in a live patient, we have to do our homework first. That is where the wet lab comes. It is a risk-free environment, and it will make the trainees to familiarize with the microscope, with the hand-eye coordination and everything. And we have to refine the surgical step, and it is a bridge to live surgery. So, setting up a wet lab, it is also very important. According to studies, it requires a room which will accommodate one trainee and a trainer, and a microscope, operating microscope, and the ophthalmic surgical instruments, and the eyes, even human cadaver eyes or animal. We can use either sheep eye, goat eye, or the pig's eyes also, and phaco machine refurbished. So, setting up a wet lab in all the training institute is very, very important. And it is, even if the eyes are not available, we can always practice some other things also, like suturing and everything. These are the minimum basic requirement instrument for a wet lab session. And suturing, as I told you before, we are suturing with the 10-0 nylons. So, suturing is the first and foremost skill every ophthalmic surgeon should have, to how to hold the needle holder, how to hold the forceps, how to pass the suture, how to tie the suture, and everything, and with how fast you can do under the microscope. These are the skills every ophthalmic surgeon should learn. And also, I am telling you, this is a very key point, because suturing is your life jacket. Because whatever happens, you have to suture it back. So, you have to maintain the globe integrity of the patient. So, suturing is the first and very important step you have to learn. And you have to suture in the polyurethane foams sheets or the banana peels. Where I worked in Singapore National Eye Center, the trainees, the residents, first year trainees, unless you do the wet lab session, you are not allowed to enter into the operating theater. So you have to suture 100 very good sutures before entering in, and show it to the mentor before entering into the operation theater. Okay, these are the ways you can practice the suturing in ophthalmology. And coming to practicing the steps of surgery. So, human cadaver eye is the best model, which is very less available. So, we can either use goat's eyes or pig's eyes also is fine. And you have to stabilize the eye. You can either also use the tape also, micropore tape also, and mount secure in place And these are another stabilizing instrument you can buy. It is available online also. And even in one, coming to the tunnel construction, in one eye you can practice 4 sides of the eye. 4 tunnels you can practice. And before starting with the SICS, trainees has to practice at least 20 cornea scleral tunnels. And also capsulorhexis, even though it is the feel is little different, can definitely practice rhexis in a got eye. So this is a video of a wet lab training session practicing the tunnel. And also capsulorhexis, usually previously we used to steam the grape, tomato to get the real feel of the capsule, anterior capsule, and practice the capsulorhexis. It can be also done in thin films also, and at least 100 attempts of capsulorhexis should be done. So these are the ways you can practice the capsulorhexis in the films. Also, the practice you have to, I am going to show you a video where we are doing a SICS in a goat's eye. So just imagine how a surgeon who is doing at least 20 cases in goat's eye like this, SICS, how the person will perform in human eye. If a person can do, if a person can do at least 20 cases of SICS like this in goat's eye, how that person will perform very well in the real live surgeries. So before going to do live surgeries on live patients, surgeries on live patients have to practice the wet lab very carefully and very meticulously, and your skills should improve. Even the cortex wash. And in the end, implantation of a PMMA lens. Also coming to, this is a structured course on phaco. So before going to phaco, what all homework we should do actually. So first homework is know the phaco machine actually, how the phaco machine works. It has mainly 3 components: foot pedal, console, and handpiece. And what machine you are using, Venturi or peristaltic machine, what is the aspiration, what is the occludability, what is followability, what is surge, how to prevent surge, and how you can navigate everything forward also. And when in SICS, basically our eyes and mind and hand are working. In phaco, everything should work together, like eye, ear, hand, foot, mind, everything should be open. So regard to eye, the visual microscope, the proper depth perception is more important in phaco compared to SICS. Ear, auditory, and hand coordination, foot pedal, how to navigate your foot pedal. At least actually 2 hours you have to train your foot in the foot pedal, how to navigate from aspiration to irrigation to aspiration to phaco machine before doing it on live patients. Also, this is a platform, Help Me See, where AOS has done, where you can practice the simulated phacos in this machine, where you will get the feel of a live patient. Okay.